Good afternoon and welcome to the OR Today webinar series. We're excited to have over 200 registered attendees for today's webinar. Just a quick reminder that our fourth annual OR Today Live Surgical Conference will be held August the 26th to 28th in Nashville, Tennessee. So make sure you save the date. Please visit ortodaylive.com for more information. Okay, let's kick off today's webinar by giving an OR Today Live surprise pack to the attendee that can tell me what percentage of roses purchased on Valentine's Day are red. Answer now using the questions feature on your dashboard. While you're answering, I want to remind you today's webinar is eligible for one continuing education hour. To obtain your certificate, you must complete the post-webinar survey, which will appear immediately on your computer screen at the end of today's call. Now, 2 lucky attendees will have the opportunity to win either a $100 Visa gift card, courtesy of Ultra Clean Systems, or an Amazon gift card courtesy of OR Today, just for completing the survey. Okay, and let's see who the winner of our OR Today Live surprise pack is. And it's, let's have a look. It's Fred Alston. Congratulations, Fred. The correct answer is 75%. Our presenter today is Tom Overbey, Director of Marketing at Ultra Clean Systems. Tom, you may begin whenever you are ready.
Well, good morning, or good noon day, or good afternoon, depending on which time zone you're in. Welcome. A Cavitating Experience presentation on ultrasonic cavitation. This is a webinar for SPD professionals, but I would imagine with the 200 plus attendees out there that encompasses many other disciplines, including OR, nursing, staff, infection preventionists, as well as sterile processing department technicians. So there's going to be all kinds of things to discuss today. So there's something in it for everybody. So since we just had Valentine's, I guess it's kind of a Whitman sampler for today. But first and foremost, for you all attending, I have to say thank you very much, but not just a thank you for attending specifically. I have to thank you for all the dedicated service that you all provide, no matter what field or walk of life you are in the healthcare industry. That is in terms of keeping patient safety high and ultimately infections low. So because of this, there's always room for improvement, however. Otherwise, we would never advance. And we'll get to a couple of thoughts about just that statement in just a moment. In terms of the presentation today, what we are all about as a company is cleaning instruments. And a little tongue-in-cheek here, and I would say metaphorically speaking, showing an instrument, actual musical instrument in this machine here is the fact that we're going to talk about cavitation, and cavitation very much directly relates to sound energy underwater, and we'll get to that in just a minute. So, but basically, no, we're all about focusing on cleaning surgical instruments and only surgical instruments. Today, we're going to talk a little bit about resources, new AAMI guidelines, and that includes point of use, working together. And we're going to talk about, let's not work in silos, let's work together and advance what we're doing together. Misfolded protein, we're going to talk about that just a little bit. And bubbles. Well, and bubbles, how it relates to sound. How does that happen? We're going to really get into that a little bit. And I think that what you're going to find is that in the sterile processing department, where a huge majority of instruments are indicated for being cleaned in an ultrasonic cleaning system, these bubbles actually formed underwater create quite a bit of an effect. It's not just a machine sitting in a corner making a hissing sound or maybe some cases a buzzing sound. It's really doing great work. Thus the reason for it being indicated in so many IFUs. So, cavitation. But first, I want to mention or discuss with you a little tribute. And that tribute, I want to do a shout out for Ignaz Philipp Semmelweis. You can see he was born and died in the 1800s. And he was a Hungarian physician now known as an early pioneer in antiseptic procedures described as the savior of mothers. He discovered that the incidence of perpetual childhood fever could be drastically cut by the use of hand disinfection. Now that's phenomenal, all right? And I'm sure any infection preventionists out there can greatly appreciate this, as would anybody else. He proposed the practice of washing hands in chlorinated lime solutions in 1847 while working in Vienna General Hospital's first obstetrical clinic, where doctors' wards had 3 times the mortality of midwives' wards. Despite his publications showing hand washing reduced mortality to below 1%, Semmelweis's observations conflicted with the established scientific and medical opinions, and his ideas were rejected by the medical community. Now that's horrendous to think that today. I'm sure to have 100% in agreement there. But he couldn't explain his findings, and some of the doctors were actually offended that they would have to wash their hands. Go figure. Widespread acceptance when Louis Pasteur confirmed the germ theory and Joseph Lister, of famed Listerine, practiced and operated using these hygienic methods. Sadly, in 1865, Semmelweis was committed to an asylum, where he died at age 47 after being beaten by guards only 14 days after he was committed. Now, if you think about that for a minute, how rather profound that was. Can you and really rather hard to swallow. But today, we want to, I guess, give a little tribute to him and honor the fact what he basically died for, and we're moving forward to keep infections low. And a lot of that based upon his initial findings. So, moving along, what is cavitation and why do I care? Okay, so we have a little bass note sounding there coming out of a speaker. This speaker is moving in and out, and it's creating a variation of vibration of sound waves. When it pushes out, increases the pressure. When it comes back in, it decreases the pressure. You have these in terms of a bass frequency note, it's not that many vibrations per second. Even as slow as several vibrations per second, you would only perceive as vibration. But what we have is basically imagine a rubber band and it's loosely strung between your fingers and you pluck it. You can basically see this rubber band moving back and forth and thus sort of visually translate how that's being perceived by the ears. So, in the case of a guitar, even plucking the strings, you can see the movement. And this is all happening visually and as well as being perceived by your ears as the sound pressure waves transfer across the room. But as we raise that frequency, as we increase those vibrations per second, we get a higher pitch, thus that we would have from, say, a flute. Now, what the heck does that have to do with bubbles? Bubbles are seemingly so innocuous. Well, they're really quite very ferocious, basically. If you take bubbles and you actually can present them underwater, that's a whole other matter. You can have some really interesting things begin to happen as we can then transfer this energy that these bubbles are being created through not sound energy as we know it in air, but sound energy, sonic activity underwater. Let's take that example with cavitation, with sound energy underwater, and let's look at it basically in nature. There's a nice, beautiful picture of a mantis shrimp. And he's got these two appendages, and you can see in the bottom center of the picture with the foremost of the appendage there, he has two of them, a left and right, and he can attack the shell, and he can attack it very, very quickly, and he can basically crack a shell open with this enormous force that he has as this little creature. But it's not just that force. There's actually a negative pressure that's formed, a sonic explosion underwater, and you can see this bubble that's been formed, a gaseous bubble that's been formed, whereas a bubble wouldn't normally exist. Now think about it. We're actually creating a gaseous bubble because what is water? It's composed of two gases. So we had take that same sort of energy and we use these cavitating, these sonic energy producing instruments like speakers, okay, and we call them transducers. That's what a speaker is. These two engines, okay, this identical engine actually was submerged in an ultrasonic bath and cleaned with ultrasonic cavitation energy. And you can see quite a bit of difference from this aged engine on the left and how clean it came out on the right. But take, for example, this part that's a split screen, this geared component, and how it was used and abused and aged on the left side and then immersed in an ultrasonic system. It is a beautiful specimen on the right side now, and it took quite a bit of cavitation energy, but enough to really eat the paint off of this. Okay, so at some point we have to form a balance between how much cavitation energy is too much or not enough, because we have a heavy load to balance in the sterile processing to get those sets back up to OR. Here's an impeller that shows drastic abuse through cavitation as it spins through water. So cavitation is good, and it can be a bad thing. So let's look at one of these mysterious, very highly powerful bubbles. So we'll step through this. As that negative pressure occurs, like we saw with a mantis shrimp, a funnel begins to appear inside the bubble. The bubble begins to turn inside out through what we call a jet in this area right here. And this bubble is actually imploding in on itself, and it is creating this pressure that actually can help to remove bioburden off of surgical instruments. And it might be a little clunky for you, but here's a little video of that action. Now, if you take enough of this cavitation energy near and around and adjacent to bioburden, those little explosions, those implosions, is what's helping to remove that bioburden off your instrument. Okay, that's great, great stuff. It has been declared that the cavitation energy can actually, at that very instantaneous moment, right in that very immediate vicinity where that gaseous bubble implodes, the temperatures can exceed that of the sun. And that's scientifically documented. You can check that out. So let's look at some of these underwater speakers. There's a myriad of different types of designs and lengths and strengths, etc. But on the left, there's rod transducers. Those are basically put into these ultrasonic machines inside the basin. So they emanate their energy from within. Then you have bonded transducers. They are actually glued to the underside or the underbelly of the basin. And we're going to step through a little video here on the energy that emanates through and outwardly from these transducers and talk about this energy more specifically. Now I'm going to show in this example a rod transducer. It doesn't matter which transducer that we're going to show. The energy that emanates is basically very much the same principle. So as these speakers underwater actually begin to vibrate at ultrasonic frequency, okay, we've gone from bass guitar to flute way on up beyond the level of hearing. These speakers are actually vibrating. They're actually distorting in very, very minute levels in terms of distortion or changing in its dimension. Okay, so let's go with that. So in this case, the energy emanates radially, outwardly from the transducer, or if it was bonded, it would radiate also outwardly into the basin. And it's this energy that creates this cavitational force. Now what we're going to look at is this section of the video and stop and show you. Okay, so on the left, we have what we're going to compare is with high frequency to that on the right, which is a lower frequency. So we have basically identical situations, and we have on the left, the transducer is speaking, if you will, emanating energy at a higher frequency, and then on the right, at a lower frequency. So what's the effect of that? Well, with a higher frequency, that is using the same power, we have smaller bubble formulation. On the right, we have thus larger bubble formulation. And so what does that mean? Well, given certain situations and repeated use, you can see the larger bubbles, the bubbles that are having more of an effect on an instrument over repeated usage. Okay, this is multiple uses now. You can actually do damage to your instruments, just like we saw in cavitation in industry. Conversely, if we have bubbles too small and we don't run the process long enough, we can still have bioburden on the instruments. Okay, so we have quite the extremes here in these two cases. In the next example, now we're going to have differences in power density, but we're going to show this example at the same frequency. Okay, so that's showing a little bit sort of a fuzzier ring here for lower, demonstrating lower energy, and here is greater energy. So we advance through this. And if you note, by this example, we have bubbles relatively the same size, but the energy with which these bubbles can cavitate can do something very similar to what occurred with the differences in frequency. And that is, over time and multiple uses, you can also do damage to your instrument. And not enough power, you may still have bioburden. Now, smaller bubbles can get into tinier crevices. That's a good thing. But I know we have quite a heavy load to balance, correct, in the sterile processing department. So we have to find that good balance in terms of searching out a good machine that's going to deliver for you what types of instruments that you do most. So that at the end of the process, you're confident that you have a nice, clean set of instruments that you can then move forward through automatic washer disinfection and or straight into sterilization, prep and pack. So I think that's pretty interesting. Let's talk in terms of a point of use. So particularly with regards to what Amy is now saying and what we feel that is very important early on in the cleaning process is actually in the operating room. We're going to talk about that in a couple of perspectives. Now, some of you out there may have a facility that does not have a Da Vinci system in it for minimally invasive surgery with robotics, but there is the XI instrument sets out there, and there's the S and SI sets out there. And like any other instrument, they do need cleaning. In the OR reprocessing wall chart for cleaning, you do things in the OR which we call point of use. Remove accessories, wipe the instruments, prime and wet them, and pack them and transport them to sterile processing department. One of the things that we see that I'd like to point out to you here is that if you're being vigilant in the OR and you're cleaning your instruments or you're starting the cleaning process in OR, you have these vials that you insert the distal tip of the robotic device in, and if you note in this particular case, this bubble has formed here and it's not quite cleaning the instrument, it's not touching there, it's not really allowing it to do its full job. Whereas if we suggest to you that if you tilt this instrument down and the distal tip is actually completely immersed in a detergent and it's starting the cleaning process. So we're talking point of use that is in the operating room, and I'd like to throw a poll question out to you in this regard. And I believe Linda's going to have this question for us to ask about point of use.
Okay, Tom, that first poll is visible to attendees if you wanted to quickly read through it.
Great. Yes, if you're not in OR, you don't have to, you can opt out of answering the question, but I might add that this is a blind survey, a blind poll, so it doesn't really matter. You can speak, quite transparently if you feel like you're exercising point of use, or not. And like I mentioned, when we got into this little section of point of use, we'll be talking about it a little bit later with regards to what Amy has to say about that, the Association for the Advancement of Medical Instrumentation. Of course, those are the folks that created ST79 and have just recently released a new set of standards.
Okay, Tom, I think a majority of people have voted. So we have 45% at within 15 minutes, 29% at 15 to 30 minutes, 19% at more than 30 minutes, and 6% aren't sure.
Okay. That's great. So that's good to see. If you're getting your instruments, if you're, getting them wet, and if you're preparing them, sending them down to OR right away, that's fantastic. And if you're not, then I think that's a good thing to really consider, because we're all trying to work together to lower infection and not working in silos. So let's continue on. Thank you, Linda, for that. So the instruments come down to, we're talking about the robotic instruments. They then leave the OR and they come down to sterile processing, and you remove any accessories that are on these instruments that may still be on there or have been not taken off, for example. And you prepare an enzymatic solution and you prime your instruments. You'll actually inject detergent solution into your robotic instruments through adapters, through tubing, and you soak the devices for 30 minutes. You flush them for 20 seconds, and you spray them, you brush them, you try to turn the dials and make the different articulations with the device so that you can clean in all the surfaces that aren't necessarily exposed. You rinse for 60 seconds and then ultrasonic cleaning. And that's indicated in pretty much all the minimally invasive robotic instruments. We recently had a poll, and it said that basically these were considered one of the most difficult instruments to clean. And so that's why I'm spending a little bit of time here with you today. Again, starting right from the OR all the way down. Then the instruments afterwards are flushed, there's a final rinse, and then you inspect, and that's a really important step, okay? And interestingly enough, thermal disinfection is an optional step. So I thought I'd point this out to you, and let's move to the next slide, which shows you a URL that I created. This is a bit.ly, or a shortened link directly to all of the Da Vinci robotic instruments, their IFUs. It's bit.ly/DA, uppercase V, and then lowercase INCI, uppercase I, FU, and lowercase s. So I've indicated this as IFU URL or web addresses ASAP if you need them. So notate this. This will take you right to their IFUs, and these are all fairly new IFUs that have been recently released. It's great stuff. They've done Intuitive Surgical has done a great job in making them very, very much simplified. So moving in to the new AAMI guidelines, for those of you that are familiar with AAMI and attend AAMI, blessings to you. I know there's some of you out there, but there's probably a lot of folks that aren't really sure about what goes on behind those closed doors on those AAMI meetings that occur twice a year. And this is where the dedication across many industries come together and meet and lower their barriers, and actually can set these standards in motion for everyone to then heed and observe and utilize and practice to lower infection, to work together. They spend a lot of great time, and I think that deserves a lot of respect and attention to the product that they put out. Not a product that they so much sell, but it's a product to help keep infection low, and that's priceless. So some of the new stuff is decontam gloves, utility gloves that should be fitted at the wrist, prevent contact of wearer's skin with contaminated water, and have cuffs that extend beyond the cuff of the gown. As you can see the arrow pointing inward-like. This indicates the section 04, 05, 02. So, some of this stuff may seem obvious to you, but these things get documented so people can become in the know or be reassured of something. Changing cleaning brushes, and reusable brushes should be cleaned after each use. It should be disinfected or sterilized at least once a day. Very important. You see people sometimes they short on time and they're short on inventory and use brushes with bristles falling off and use the brush over and over again. But this has now been indicated in the newest of the FC79 releases. Section P1, towards the end, cleaning and disinfection general considerations. These processes are designed to remove soil and contaminants by cleaning and to inactivate microorganisms by disinfection and sterilization. This process involves the following sequential steps. Point of use. So here we are, we're back up in the OR. And again, I can't say it enough. Let's not work in silos. Let's work together so we can coordinate. Know your OR staff, and OR staff know your sterile processing department, people, your personnel. We're all in this together. Thorough cleaning, as you would expect, and disinfection and sterilization. So, Linda, this brings us to our second polling question. Can you bring that forward?
Yep. The attendees should be able to see the question now.
So, while you're in the OR, do you use an enzymatic spray? We're looking more specifically for the folks that are in OR now that are doing the things that they do, or any combination. We just like to know so that we can do our job better and spread the gospel better, if you would. Linda, do we have any results from our polling question?
Okay, we've got 51% use an enzymatic spray, 8% immerse or flush, 8% apply a wet towel, and 33% do a combination of all of them.
Great. So we're not asking the question, do you or do you not? We're asking the question, what do you do? And that's because we have faith that we're getting those instruments starting to be cleaned in point of use. We're starting to see an uptick in the OR staff getting things done early. It's fantastic. I can only suggest that we continue to move forward and advance and get better. I'm sure of that. That's going to help everybody. Ultrasonic cleaning equipment. It's only used if it's indicated by the IFUs. However, there's many IFUs that do require ultrasonic cleaning. But change the cleaning solution, after each use. That is now new in AAMI. It wasn't explicitly stated as such in the past. I think of it as my dishwasher. I certainly wouldn't want to eat off of dishes that come out of my dishwasher that's used recycled water, dirty dishwater. Nor would you want to, if you were in the hospital, have instruments used on you unless the water, the bath was clean after, for each new use. And of course, the gross soil needs to be removed. Okay, pre-cleaning point of use is good, but pre-cleaning and washing and soaking still has to be done. Ultrasonics are powerful. We've demonstrated that, but you still have to knock off all the stuff that doesn't make it so that the ultrasonic machine has to work harder to get the job done. So we know that the instruments have a greater chance of being even more thoroughly clean. And then, of course, thorough rinsing at the end. Some ultrasonics will clean their instruments or will rinse inside the basin at the completion of their cleaning process. Degas the solution prior to use. There's all this gaseous potential in this bath. Of course, again, water's made of two gases. So if you disturb it enough, you're going to generate a gas. So if you can degas some of this gas that is from the dissolved gas in the water, you can actually make the fluid in the bath more continuous, more solidified, for lack of a better example. And therefore, the ultrasonics can do its job much better. Avoid placing plastics and soft metal, such as lead hands, in the ultrasonic cleaner, because these sort of absorb or dampen or diffuse the ability to do ultrasonic cleaning. Ultrasonic cleaning should be cleaned daily. So I kind of covered that in the previous slide. Remove rubber or silicone mats. It's been proven that these mats can actually inhibit ultrasonic cavitation. And maybe you might expect that because it's going to absorb some of this energy because of its elasticity. The rationale is that they absorb and impede, thus sanitation is the way the AAMI document states it. So place items in open weave or perforated metal baskets below the water level. Of course, it's got to be below or else it's not really going to be doing its best. And put heavier items on the bottom. Okay, and then when required, connect lumen devices to flushing ports by tubing and adapters. Again, we have a little mention of a robotic device where they have flush ports, depending on what generation you're using. You connect your tubing so that then your ultrasonic machine can actually process the fluid through these devices. When you're unloading your system, carefully remove instruments. I think that doesn't necessarily need to be stated, but again, it's in the document for you. If connected to any flushing ports, of course, disconnect those. Do so carefully. And if the sonic doesn't have a rinse, then rinse and inspect for cleanliness. And if it's clean, go to the next step. Verification of the cleaning process. This is also a little bit more better or more thoroughly stipulated in ST79. Inspection using magnification might identify residues more readily than the unaided eye. Okay, the use of methods that are able to measure or detect organic residues that are not detectable using visual inspection should be considered in facility cleaning policy and procedures. And this is further clarified in Annex D. So there's a lot to be said by visual inspection. There are various instruments for visual inspection. There's microscopic type devices, fiber optic type devices, and you can see in the picture here with just a nice magnifier. It's certainly better than nothing. Verification of the cleaning process can also include, say, for instance, the mechanical cleaning of equipment performance. You can use these metal coupons, that some people know them as called wash checks, and you put these in your ultrasonic machine while you are processing your instruments. And there is a blue soil that can become removed from these to show where you have had cavitation energy affecting the cleanliness of your instruments. You should be doing this each day, and it's used, and it should be done each day, and all the results should be recorded. These can be easily recorded. Here's an example of where different levels of blue have been removed, different levels of soil have been removed, and if nothing's been removed, of course, it's a complete failure. But if there's any blue showing up, those also are considered a non-pass. If the blue is completely removed, that's considered a pass. And this one type of cleaning verification is easy for record keeping. It's really great for trend analysis because they're inexpensive and you can display several of these in a tray at one time at very little cost. There's other methods of verification. There's a foil test, and this also provides for easy record keeping, and it's very inexpensive with basically a piece of foil immersed. However, the downside is you have to basically run this performance test by itself. You wouldn't run this with cleaning instruments. So with regards to also cleaning verification, when we're talking about in a specific case with bonded transducers, where the transducers, those speakers, are glued to the underside, you can see the cavitation energy spiking up from the bottom through the basin. Now, between these devices, between these transducers, you can have cold spots. Now, this is showing you just very clearly where these cold spots might occur, where the cavitation energy doesn't cross over. Okay, most every manufacturer makes machines with these bonded transducers. We do as well, but it's something to pay attention to. So if you follow me here with this, if we have a transducer that is failing, we want to make sure that we can verify our machine is showing that. So if we used a verification tool in a process, such as what I showed you before, the metal coupons, then we can determine perhaps maybe there's a transducer that's not working. So very, very important that Amy has stressed these verification processes. You also want to make sure that your water flushing through these through the ports of your lumen instruments is actually occurring with nice throughput. But also cleaning verification, nothing beats still looking at your instruments with the naked eye. We talked about magnification. We talked about different ways of looking at the instruments, and those are all devices that are useful to you. But do your diligence and at least make sure and visually check your instruments. So, and then in terms of verification testing, do so daily for your cleaning effectiveness. Okay, visual inspection, ensure your items are clean, just like we just mentioned. Cleaning daily. Drain the cleaner, wipe with disinfectant cloth and dry, and don't use corrosive chemicals. Follow the manufacturer's IFUs for the cleaning process. Daily equipment inspection, check for leaks, make sure the basin's filling, and change your filters daily. Please. A minimum weekly, preferably daily, cavitation. Confirm cavitation is occurring in the system. So you can do that with a foil test or other readily available devices that are mentioned in ST79 and some of the ones that we've mentioned. Minimum weekly lumens. Confirm that ultrasonic can clean your lumen instruments and then also visually inspect. Again, particularly with lumens, that's where you can get into the nice microscopic and the fiber optic devices. They are wonderful devices. And then as far as record keeping is concerned, showing these devices, again, these metal coupons known as wash checks. You can see this is a logbook that can easily be stapled or taped in, and you can use them, many of them per step, per process, and you should be doing them hopefully at each process. You can see the log here shows throughout the day they've been recording them. So, ultrasonic cleaning verification, great for record keeping, and they provide evidence for accreditation audits. I think that's useful. Also, knowing your machines are working properly, and this can have an impact on lowering infection, and that's what we're really all about. I think we can all agree on that. Instruments that have residual protein, particularly, cannot be effectively sterilized. I know the ears of the infection preventionists that are out there probably perked up when you see Bill Ritala, well renowned in terms of infection prevention. So I'm going to show you this slide here. You see there's two instruments. One is clean and one is dirty.
Okay, the attendees can see which instrument is clean and free from protein.
So have a little fun with this one, okay? So which one do you think is clean, the one on the left or the one on the right? And this is basically in terms of free of protein. Let's see how we do.
Okay, right. We had 32% for the one on the right and 68% the one on the left.
Thank you, Linda. So as you can see here with these results, the one on the left, which appears to be completely clean, is actually the dirty one with 24.6 micrograms of protein through fluorescence imaging technology, whereas the one on the right, which doesn't necessarily appear to be clean, is indeed clean with 0 micrograms of protein. So the takeaway is, just because your instruments look clean doesn't necessarily mean they are clean. So be vigilant in your protein checking especially. With regards to protein and how it relates to misfolded protein, those are those proteins that create those TSCs, those transmissible spongiform encephalopathies that we've heard in the past from prions, which are those misfolded proteins where CJD came from. And we have to talk a little bit about this now because there's the chronic wasting disease. I'm not going to ask you who knows about this or who doesn't, but I think that it's a good thing to be aware of because chronic wasting disease, again, this is from misfolded proteins. And we certainly don't want misfolded protein by any means on any of our surgical instruments. The chronic wasting disease is also a transmissible spongiform encephalopathy. And we find it in mule deer, white-tailed deer, elk, moose, and reindeer. So this is what we call the cervid family. And this is due to the misfolded protein called prions and can exist for decades in nature. And this is known, there's no known cure, and attaches very well to surgical instruments because it's hydrophobic protein. It doesn't just jump off of the instruments. This is showing the areas in the U.S. and in Canada where it's been found in these free-ranging and actually those that are also held in captive where the chronic wasting disease has been measured. Currently, CWD has been documented in 23 states, 2 Canadian provinces, Norway, and South Korea. Deer infected with CWD found in Mississippi on January 25th, that's last month, that now totals 24 U.S. states. And the sad part about this is there is growing evidence that suggests that, like CJD, chronic wasting disease can cross over to the human population. So what does that mean for us? It just means that we need to be extra vigilant and making sure that our instruments are clean. Okay, and I think that's very important. So in terms of resources, we have our final poll question. And so if it's the question Linda has before you, I can't see it. Do you feel your facility provides adequate training and education on the instrument cleaning process? Okay, so yes, we have on-site resources. Yes, but we have reps or consultants to provide the necessary education. No, we could use additional support in this area. And or no, we have no support, sad to say, but I had to put that in there as an option.
Give it a couple more seconds. Good. Right. We have 31% says yes, we have on-site resources to help. 44% said yes, but we have reps and or consultants to provide the necessary education. 25% said no, we could use some additional support, and 0% said no, we have no support.
Okay, great. I'm happy to hear that. You know, I have heard situations where hospitals are, pleading for help, and I am happy to report to you, and I'm glad you can also support this. Is that there is a lot of organizations now out there, and there's more of them coming about. We're familiar with AMI, ISHM, International Association of Healthcare and Central Service Materials Management, great organization. But even on the nursing side, we're also talking together now, okay, in terms of, particularly in terms of scopes, right, which isn't the scope of, no pun, the scope of this presentation. OR Today, the folks that are putting this webinar on, also have a national conference since now for a few years. The CDC, of course, FDA, Joint Commission. I didn't put on here CCSVP, also a great source for getting accreditation. APIC. But the point of putting all this here is not just to recognize they're there and attend, AMI once a year or that sort of thing, but really embrace these. Consider spending a little extra time and resources in looking at newsletters and sources where you can gather information. And speaking of sources, a lot of you probably have heard of one source. This is a great repository of IFUs. Over 165,000 links to IFUs from over 1,400 manufacturers. Some hospitals have accounts with them and some facilities don't. But I really urge you to, if you have the account, if you don't have the account, get one set up if you can, because this is just such a great bridge to have one source, as it's named, to be able to get this information on how to clean these instruments. We know about AMI, but even on the mobile side, here's a nice AMI members discussion group that you can actually look at over your phone and send questions back and forth to each other. You don't have to be in sterile processing either to be a member of AMI. Anybody can join this organization. There's a plethora of books that are available through AMI as well. There's also LinkedIn, so we're getting sort of on the social side of things, right? So we can exchange ideas and considerations and concepts and how people are doing things. So we can do this all year long instead of waiting for, say, on an annual conference just to get together and hook up with your friends and exchange what's been going on. Beyond Clean with Hank Weston. He has a weekly podcast, and it's phenomenal. It's off. I think it's been, I don't know if we're in 12, 13, 14 weeks now. It's an hour-long podcast every week, and they bring very interesting speakers in to talk about various aspects of healthcare and sterile processing and the like. So these are all resources, most of which are free and available to you, but also use your own resources, your own mind to go out and look for new things. This is a new double gloving system that was recently introduced, and it makes them very easy to put on, but not only are they just double gloved, but you can see the differences in color. So if you get a nick on the outer glove, it immediately shows the bolder green through the cut, through the incision. So, these are extra things to help even improve the safety of the staff. So I urge you to look beyond the four walls of your sterile processing department, beyond the four walls of your OR suite, and really expand the horizon for expanding your own intelligence and your own the cause for the goodwill. Some IFUs are just impossible to follow in the real world, and others really don't get to the root cause of why they can't be clean, which is a design issue. You will need to develop your own cleaning protocol that not only meets the IFU but exceeds it. And that's by Damian Berg, which I'm sure a lot of you know, President-elect for ISHM. The gentleman really stands behind what you're all about. So his information, and try to do the best you can. Use the resources that you can, and try to exceed those standards. Otherwise, sometimes you get lost in the department. I understand it. You feel like you're working in the dark. We truly understand that. Industry feels your pain. Particularly in the sterile processing department, you get backed up with all these instruments. You certainly don't want cases to be held up in OR. And OR, I know that you want to help improve the process and do the point of use cleaning. It's a tough battle to keep the instruments clean and keep the process moving. Make sure your systems, particularly your ultrasonic machines, have enough throughput to get the job done to keep up with the pace as well. So, and if you're looking for an ultrasonic system, consider the options and decide what works good for your department. It doesn't have to be a bonded transducer machine. It can be a machine it can be a machine either way, a titanium rod transducer, or TRT, or rod transducer. It can be a bonded transducer. They all do effective cleaning. Make sure that your facility has all the necessary steps taken to have your machine installed properly. That's something that gets forgotten about sometimes. We had a case where a hospital facility bought a Da Vinci system and never even asked about how to clean them. And the sterile processing department, unfortunately, didn't have the right tools to do it in the correct manner. And receive the necessary in-service training. Follow the IFUs for your machine and your instruments often. Cleaning verification, routine maintenance, and preventive maintenance. It will help your machine last a long time and help you to keep your job up, which again is to keep infections low. And I'd like to begin the conclusion here with this little picture that I took from the Lucille Ball show when they're in the candy packaging plant, and they've got the conveyor there, and the bonbons start coming out, and the rate of the bonbons increasing and faster until they start eating them. And if you consider the fact that this parallels nicely with the sterile processing department. Lucy actually says in the episode, "I think we're fighting a losing game." And I'm sure you can kind of relate to this, particularly those folks that are working in sterile processing with getting backlogs of instruments. So we understand, work together across all channels, all levels, and expand your horizons. There's lots of resources out there. So to sum up, the significance of cavitation, ultrasonic cleaning is a powerful and highly effective tool indicated for the vast majority of surgical instruments. It can really help you. If used correctly, IFUs and other guidelines and resources can help to prevent infection. And collaboration, from point of use, pre-cleaning, and the OR through SPD reprocessing. Again, collaborate with each other to help the common cause for reducing infection. Rose Seavey, a well-revered, very experienced consultant, and if you look at those line of credentials, I think you'd have to agree. She says this quite often: we are all in this together. It takes a village because we all own a part of infection prevention. It's not the destination, but the journey. as you are the best tool in helping to continually reduce infection. And I want to say thank you very much for the time here today. There's my email address. If I haven't said anything clear enough for you, if there's any questions that we don't get to answer here, I know we're running against the clock on time, email me, email me. And if I don't know the answer to the question today, or if I don't have the answer, I will get back with you. You see our URL, our web address, and there's my Twitter handle. I want to say thank you very much for your time.
Thank you, Tom. That was great. We've had a few questions come in. How long should I clean surgical instruments for?
Okay, well, that's a pretty good question. And my immediate response is, and of course you're going to hear it often, is always refer back to the IFUs, because different manufacturers require different times. So if you're going to clean an instrument that, two instruments, let's say, for simplistic purposes, one says 5 minutes and one says 10, and they're in the same bath, you're going to clean it for 10. For Da Vinci Robotics, they pretty much have set a standard of a 15-minute, I believe, minimum time for cleaning instruments. So follow your IFUs. Another question?
And another question that came in: can scopes be put in an ultrasonic?
Ouch! Oh no. That's a good question. I won't say there's no such thing as a bad question, and there actually may be some types of scopes or some parts of scopes that can be cleaned, but in general, they're very expensive devices, and they use various adhesives that keep the lens elements together in these devices. So that's kind of a big no-no in this regard. And as always, regardless of how you clean them, with regards to the specific types of machines that clean only endoscopes, do follow those IFUs.
Okay, so what type of detergent should we use in an ultrasonic?
Well, that's a good question. Let's see. Typically, of course, you're going to want to use an enzymatic type detergent. There's lots of good detergents on the market today that are of a triple enzymatic or of a quad enzymatic. They actually have the different blends of enzymatics, the critters that can help take care of your bioburden, so to speak. But you also want it to have a neutral pH, because you don't want to do any damage to anything in the instruments just for the sake of cleaning them. Water actually does a good job of cleaning instruments by itself, and by no means am I saying don't use detergent. What I'm saying is that a bath of fluid can help clean instruments, but it's those detergents used correctly really will get the job done. And please, in terms of IFUs, follow the manufacturer's IFUs for your systems, regardless of what you're cleaning.
Okay, and another one is, can instruments go directly from the OR into an ultrasonic?
Well, in general and in specific, no, because you need to. We have a lot of variables there. That's kind of an interesting question. You have to go through the pre-cleaning process, whether or not it got a point of use cleaning in the OR. We need to knock off as much of that bioburden as possible. Okay, and I hate to say it this way, but you run your car through the car wash and it comes out dirty still. What happened? You really need to pre-clean it. It needs attention. Not everything is going to affect a miraculous cleaning job over instruments unless they've been tended to appropriately. So therefore, the IFUs tend to indicate you've got to pre-clean.
Okay, and we've got. What can you tell us about ophthalmic eye instruments in the ultrasonic?
Okay. Toxic anterior segment syndrome. That's nasty. That's not good. And what I would suggest is, because eye sets tend to be kind of small anyway, you want to, of course, you want to make sure that they're disinfected prior to use. So complying with the IFUs is an understatement. But in this particular case, I would suggest a dedicated machine, a small machine that would be able to be used just for ophthalmic instruments, particularly if your facility does a high number of cases of those eye cases. So that's kind of what I recommend there on that. There might be specific baskets that you might have to have. There are specific IFUs. I believe there might be some instruments that you can't completely submerge under ultrasonics, but maybe only a part of it. So that's a really good question. And in terms of trying to avoid TAS and anything else harmful, and we're dealing with such precious tissue as the eye, I'd like to suggest a standalone machine for that, if possible.
Okay, thank you so much, Tom. We've come to our 60-minute limit, so thank you for such a great webinar. Just a reminder to attendees that 2 lucky attendees today will win either a $100 Visa card or an Amazon gift card for just completing the post-webinar survey, which will appear on your screen shortly. If you do not see the survey, please email us at webinar@mdpublishing.com. For information on our upcoming OR Today webinars, please